evening, everyone. I am Ashwini, and welcome to today's webinar. Today, we talk about the importance of medication, adherence, and risks of mismanagement. Our expert speaker will share the valuable insights on the importance of adhering to prescriptions, optimal health management, prevention of adverse event. Our expert will share the valuable insight, as I told you, the importance of adhering to prescriptions and optimal health management, prevention of adverse events. Before we move on to our main topic, I would like to give you a brief on Vayah Vikas, a registered trust with a dream to build and strengthen an ecosystem for seniors that empowers the seniors to lead a productive and meaningful life. We are a community of senior citizens member enabled through an online platform with a focus on wide range of services starting with legal, finance, health and wellness. Without further delay, I'm pleased to confirm that today's webinar is conducted in collaboration with Varidos, a smart companion from Pixel Health to assist anyone on daily medication for short, long term in their journey for better health outcome. We welcome Ms. Anusha Venkatesh, the CEO and founder of Varidos, and Dr. Chandrika Bhat, consultant rheumatologist at Rainbow Hospitals, are our speakers for the day. Over to Ms. Anusha to give us a brief on Varidos.
Thank you very much, Ashwini. Thank you, Vayah Vikas, Joyce, for this time and the opportunity. Good afternoon, everyone, to all the elders present here. I'm sure you guys have all skipped your nap time to be here. My team is going to make sure that you will have all your valuable insights that you're looking for, especially to manage your medication. I'll take a few minutes before I hand over, to Dr. Chandrika about Varidos, why it was born, and how we started it. So Varidos is actually born out of my own personal experience of managing my parents who stay far away from me, and daily medication is always a hassle for them, staying away, managing multiple medications. I have to keep tracking whether they've taken every day or not, running out of medications, and multiple confusions with similar kind of medications with the here alike and the same kind of colors and the names of the medicine. And that's when I decided to make sure that it solves my problem rather than anybody else's first, to ensure that I am completely taking care of my parents even though they are staying away. So a small setup which started at home to experiment is now a product, because we see that it has a lot of potential to reach to larger, elder care population. Because medication, it can be for elders or for the youngsters, but forgetfulness can be for anybody. Varidos is to make sure that anybody who is on medication never misses their daily doses. With that vision, I'm very, very proud to call upon Dr. Chandrika today. She's a consultant rheumatologist with Rainbow Children Hospital. She's here to share a few insights, that she has and spread light on the importance of why we have to stick to our medication. It could be for short term, like even the antibiotics. And why is it so important to complete the course of antibiotics? And why is it important to, ensure that we take the medicines as prescribed by the doctor? Thank you, Dr. Chandrika, for your time today. I hand over the session to you now.
Thank you, Anusha, for that introduction. And good afternoon, everyone. Thank you so much for joining in today. So a quick disclaimer before I start is I'm actually a pediatric rheumatologist. So I usually see children and young adults up to the age of 18. And even in this age group, we find that medication adherence, especially in this age group, I would rather say, is quite a challenge. And many a times we see children not responding to treatment simply because they've not received the drug at home. What I'll go through quickly with this presentation is just a few key points to say why it is important to adhere to medications and what are all the challenges one might actually face in stopping one from actually adhering to medications on a day-to-day basis. So when we prescribe, say, antibiotics for a simple infection, which is a 5 to 7 day course, that in itself can be quite a challenge to complete. And all the more reason, what happens is if you start getting better, there is no motivation to continue the treatment as well. But what we need to remember is that certain medications, and especially antibiotics, it's very, very important that you complete the course, even though you may start feeling better just with a couple of doses. And this is because incomplete treatment can lead to resistance to that particular antibiotic. So the next time when you need that medication, there is a good chance that your body may not respond to simple antibiotics. And that is the reason why we see a lot of drug resistance, especially in India. The whole essence of this talk is that why are we more worried about adherence, especially in elderly population? And that is because in elderly age group, it is quite likely that an individual may have multiple illnesses. So the same person can have diabetes, can have hypertension, may have high cholesterol levels. Some people may have seizures, and all of these may warrant very specific and different treatment regimens. And when you have multiple comorbidities, obviously the number of medications that you need to take, the dosing of these medications, they can be quite variable. Some medications have to be taken once a day, some have to be taken twice a day. And this can be quite cumbersome for a person to remember unless you have another caretaker who's there with you to constantly remind you that you have to take your medication. Apart from that, when you have multiple comorbidities, like I said, you're more likely to be on multiple medications, and this is what we call polypharmacy. And in the medical world, polypharmacy is a huge challenge, and in itself, it's prone to a lot of issues. That is why, as much as possible, as doctors, we try minimizing the number of medications people are on, and if possible, we try grouping medications so that you don't have to remember to take a lot of pills. And when you have to take a lot of pills, the risk of non-adherence obviously becomes more and more. And if you are non-adherent to medication, what would then happen is the underlying illness remains untreated. The issues you went to the doctor with in the first place is never going to be addressed properly. And what actually happens is that you may be taking the medication, say, on alternate days instead of taking it every day. So you still may have the side effects of the medicine, but you'll not have any benefit from the medicine. So at times, it's better probably to not take the medicine at all than to take it on an irregular basis. And what then happens, like I said, especially with some group of drugs like antibiotics, that the therapeutic benefit of the drug sequentially may drop. And this is not just for you. So what happens, for example, if you take an antibiotic drug, obviously it's excreted in the stool, in the urine. And this is what leads to what we call resistance in the community as well, because the stool and urine goes into the natural sewage and then it goes to different areas and it will come back to the other population in one manner or the other. So the water that you consume may in itself have some factors that can enable people to become resistant to certain antibiotics. And this is what happened a few years back when they tested the water from sewage in New Delhi. They found that most of the germs, the bacteria in the sewage water were already resistant to the highest end of antibiotic that we can think of. And that was labeled as ND and bug. So this is the reason why with certain set of medications, you have to be very careful because the problems that can come up with non-adherence are not just limited to you, but can extend to the entire community as well. Obviously, with non-adherence, the underlying disease does not get treated, then what happens is the health expenses then go up because in chronic illnesses, if you take your medications properly, the risk of emergencies comes down quite significantly if your underlying disease is well controlled. If the disease is not controlled, then it is more likely that you'll have acute issues of a chronic illness, and these warrant visits to the emergency room. Patients may need ICU admissions, and obviously these can increase the health expense quite significantly. And eventually, what then happens is either you're undertreated for that particular condition, or at times what happens is you may get overtreated. So when you visit a doctor and you tell them that, no, I'm taking all my medications properly, which might not be the case actually at home, what then happens is that the doctor is more likely to change your medication, increase the strength of your medication, thinking you're not responding to the usual dose or the lower end of the medication range. Now, what happens? You are subjecting yourself to more stronger medications simply because you've not been adherent to the previous set of medications, and the risk of side effects also goes up significantly. So, for example, I'll just give a very simple instance. So, this is a 70-year-old man with diabetes diagnosed at the age of, say, 60 years. And he's a person who's always non adherent with his medication, probably takes his pills twice or thrice a week. And this can be due to multiple factors, which I'll come to later on in my presentation. Now, what would then happen is the drug levels of this particular anti diabetic medication is always going to be below the range, as below the therapeutic range, what we say in medical terms. Eventually, what happens is then that the glucose levels obviously are not going to fall in the range that we desire. And this leads to multiple hospital or doctor visits because, the doctor would have said that this is the target glucose level which we're trying to achieve. If you don't hit the target glucose level, please come back to us. So you keep visiting the doctor because the target levels are not achieved. The doctor does not know that you're not compliant with the medication, and then changes the medication to a more stronger medication. Now, what happens is for the same level of blood glucose, you're taking a much stronger drug, and now you're putting yourself at a risk of developing low sugars, which is called hypoglycemia. And in fact, this is more of a problem than having high sugars. So, people are more prone to developing fits, they are more prone to developing what neurological complications if at all the sugar levels run low. So, ultimately, what happens is neither is the disease controlled. On the other hand, now that particular person has landed up with newer complications simply because of non-compliance, not being honest with the doctor, and in the process ending up taking medications that might actually, that was probably never needed in the first place at all. So there's something called the 5 dimensions of adherence, and there are multiple factors which are related to this aspect of adherence, or basically these are the factors that can affect adherence to a particular medication. So I'll go through each of these because this might be relevant to each one of you over here. So the first and the most important is patient-related factors. And as doctors, this is what we are always constantly reminded of, that whenever we prescribe a medicine, there are multiple things we need to take into consideration. The diagnosis or the underlying illness is just one of the reasons. There are plenty of other reasons, because we may prescribe a medication, but if it is logistically, if it is financially it not feasible for the patient to take, then there is no point in us prescribing these medications. So when it comes to the elderly population, obviously the mental state of the patient, especially if they're living alone, if they have no other caregivers with them, the mental state of an individual is extremely important when we take into consideration the medication we prescribe. So an individual who has lower cognitive function, so with old age, people can develop dementia, some people can develop Alzheimer's disease, or if they are depressed, they are more likely to have memory issues, and what we call they can be absent-minded with regard to their medications. So these people obviously require more assistance, either in the form of an app that can remind them that they have to take a medication, or they need a caregiver constantly with them who's going to remind them to take that particular medication. And obviously, with age, there are a lot of other mental illnesses people can develop, like anxiety, sleep disturbances, and these can impair the executive function. So, although your memory might be intact, if you don't get proper sleep at night, if you're an anxious individual, then it's more likely that you're going to be more forgetful during the day, not because you have dementia or Alzheimer's, but simply because you're stressed out. So, these factors obviously can make one forget to take their medications at the right time. So, please remember, taking medication just does not mean taking it at some point of time in the day. It is very important to take it in the prescribed schedule. Now, coming to the demographics of an individual, obviously, older the age, then you're more likely to forget. Now, male gender, I know this might be a bit of a contentious thing, but traditionally, we believe that men are more likely to forget their medications, and especially if they have lost their partner. And this is because in earlier years, usually the spouse is the one who keeps reminding them as to when to take the medicine, and especially if they lose their partner, men are more prone to missing out on their medication dosing. And low education levels, again, this may not always be true, but people who are probably from the lower, who are not very educated, they may not realize the importance of taking medications. And this is where the role of a doctor is very important, in that they teach them and they explain to them why adhering to medication regimen is extremely important. And as a doctor, what I feel is the biggest challenge with our patients is the knowledge and beliefs patient come to with us. And many times it may take multiple visits even for us to know where a patient's particular belief is actually coming from. So as such, there are different streams of medicine which people may follow, like Ayurveda, homeopathy. And it's always good to be honest with your doctor, even if you don't want to take the medications they have prescribed, that's absolutely fine. But you need to be frank about it and let them know if you're taking any other medication, especially Ayurvedic or homeopathic medication. And the reason for this is there can be very serious drug interactions between the medications prescribed by alternate streams and the medications prescribed by us. So these beliefs actually play a very important role. So please be frank about it and let your doctor know if that is the case. Again, lack of perceived benefit of medications. You may feel like, why is this doctor prescribing so many medications? I don't need it. So this is again a big challenge, especially in the elderly population. And many a times this comes down to the fact that you may not have accepted the diagnosis the doctor has given you. If that is the case, before you dismiss off that diagnosis, please meet another doctor. If even they are saying the same thing, then it's more possible that you actually have that illness. Lack of medication knowledge. Now with access to internet, this has significantly come down. Because most of the medications you can just Google online and you would find all the effects, the benefits, and the side effects. But sometimes this can be counterproductive, because I have seen patients who read up a lot about particular drugs on the internet. And let me tell you, there is no drug that does not have any side effect. For that matter, even if you take paracetamol, one of the side effects listed is liver failure, which does not mean that everyone who takes paracetamol is going to end up with liver failure. But these are things we just need to be aware of, and it is very less likely that one is going to have all the side effects mentioned for that particular drug. Again, if you're anxious about it, please discuss with your doctor before making a decision on your own that you shouldn't be taking that particular drug. Lack of knowledge about that condition, again, is quite a challenge. Like I said, many people find it hard to accept the diagnosis given to them. Please, again, talk to your doctor, get yourself reassured. If needed, go for a second or a third opinion. Health literacy in our country is usually quite low, and that is because there are a lot of inherent beliefs, and also there is a lot of inherent, probably, bias against the medical fraternity. People don't trust doctors easily for whatever reason, and this can lead to a lot of issues surrounding what you know about a particular illness, which is absolutely fine. But again, please be frank with your doctor if you're not going to take that particular medication. Misunderstanding of verbal instructions. If you, when the doctor is telling you, teaching you as to how to take a particular medication, if it is not written in the prescription, please write it down yourself and the doctor is explaining to you, so that you don't forget it later on. And lack of threatening view of an illness, and that is true for most of us. We probably do not foresee the complications of a particular illness we have. We think it is quite benign. We may not become very unwell with that particular illness, making us more lax with our medication. And higher perceived illness burden. So this is particularly, I think, true, especially in the pediatric population. Parents are never able to accept that their child has an illness, and they think doctors are over exaggerating the condition, which can happen even in the elderly age group. Again, like I said, the most important thing to do is ask your doctor the right questions, and if in doubt, go for other opinions. So then there are some medication related factors. So these are issues that as doctors or nurses, we need to keep in mind. The formulation of the drug. So there are some drugs that sound alike and look alike other medications. So what we say is, ideally, most of the pharmacies, they should not keep drugs that sound similar to each other. By that I mean the brand name shouldn't sound similar to each other. I'll give you one example which happened in the pharmacy nearby. So there is this one medication that is used for fever, which sounds, the brand sounds similar to another medication that is used for fits in children. So when this family went to the pharmacy outside, they were given, instead of the medicine for fever, they were given the medicine for fits. And the parents kept coming back to a hospital saying our child is more drowsy and we don't know why. So this child was admitted. Multiple tests were obviously done to see why this child's consciousness level had gone down. And actually, subsequently, what we got to know was it was simply because of a drug error by the pharmacy, who gave a drug that sounded similar to the fever drug. So this is quite common, which is why it would be good practice for you to ask your doctor to also write the generic name of that particular drug, so that you can verify it yourself when you buy the medication. Packaging issues, again, some medications, they're packaged similarly to another medication. And this is the reason why you should not cut. So if you have a strip of 10 tablets, please don't cut one single tablet just for easier access. Please keep the entire strip with the name of the medication and the expiry date just as it is. Please don't cut the strip into smaller pieces. And drug storage issues, again, some drugs are very heat sensitive, so you'll have to keep it in the fridge door. It would be a good idea to check either with the pharmacy or your doctor when they're prescribing this medication. Drug handling, lack of use of medication boxes. So there are medication boxes where you can actually segregate the drugs based on the day of the week. It's a good idea to use one of them because if they're completely packed in a particular packet or they're not stored properly, some of them may lose their effect. And necessity to cut tablets, again, that's not something we would strongly suggest at all unless you have a caregiver who's very careful and has segregated the drugs differently so that there is no issue with the name of the drug. Difficulty opening containers. So this can be quite common in people who have arthritis. So if they have arthritis of the wrist, be it osteoarthritis or any other form of arthritis, it may be hard for them to open containers. So in that situation, please change the type of container in which you're storing the medication. Now, drug regimen, polypharmacy, like I said, when you're on multiple drugs, each drug has a different regimen. It's easy to get confused. So please write it down legibly and probably stick it up somewhere where you can see each and every time you're taking that particular medication as to whether you're taking at the right time in the right dose or not. Medication regimen changes. When you go for a follow-up to your doctor, if there is a change in the medication regimen, please write it down again legibly, because otherwise, if at all you have issues with memory, when you get back home, you're more likely to forget the change that has been made. And complex dosing regimen, sometimes it might be unavoidable, but if you feel the regimen mentioned by your doctor is extremely complex for you or your caregiver to understand, please tell your doctor to change it immediately, because taking medication in the wrong way is more harmful than not taking the medication at all. And obviously, there are a lot of other factors such as the cost. So finances may be something that's difficult for some people when they're of a particular age. If they've stopped working, there is no pension, then money becomes an issue. There are many alternative agents for every drug that is prescribed to you. So please ask your doctor in that situation to prescribe a brand that is less expensive. Adverse drug reactions. Again, this is something your doctor would tell you when they prescribe the drug. If not, it's always a good idea to go back and check with them. Now, drug-to-drug interactions, as I said, people are more likely as they grow older to have multiple illnesses. And for each illness, you may have to meet a particular doctor. So for diabetes, you might be going to an endocrinologist. For hypertension, you might be going to a cardiologist. And each one of them is only going to focus on their area of expertise, and they'll prescribe medications unaware of what medications you're taking otherwise. So whenever you go, please make a list of all the medications you're taking and show it to each and every doctor that you're going to, each and every specialist that you're going to, so that they can then look at possible drug-to-drug interactions before prescribing the medication. Poor labeling instructions. Again, if in most of the Western countries, when they dispatch the medicine, the labeling, the instruction is mentioned on the container itself. We don't have those facilities here in India, and that is why I keep saying that please write it down somewhere and stick it on a place you're more likely to read during the day as you take your medication. Now, there are also some healthcare provider related factors that's mainly coming from doctors or the pharmacist who's giving you the medication. The first and foremost important thing is poor communication. If your doctor is extremely busy, they may be spending only 5 to 10 minutes per patient. It is more likely that you would forget to ask a few questions. And likewise, it's quite possible that the doctor is going to forget to give you a few instructions. Again, please write down all the questions you have for the doctor before you go. And one of the questions should be that please explain the medication properly so that you can ask the doctor in that limited span of time to explain whatever you feel is important for you. Lack of patient involvement, and this happens usually when we see, so as a pediatrician, when I see parents coming with the child, most of the times the parents are extremely involved. But what we see with elderly people is that if they're coming with their children or the grandkids, the children or the grandkids may not be that involved during the consultation. So it would be a good idea to take someone along with you who's actually going to be more aware and alert as the doctor is speaking to you. Prescription by non-specialists is a huge problem in our country. And by non-specialists, I mean going to the pharmacy and directly buying a medicine, saying, I have a cough, please give me something for the cough. Now, this pharmacist has no idea what other medications you're on and how this is going to interact with that. So please do not go and ask for medications over the counter. That's a practice that's completely to be abolished. Lack of trust, like I said, of late, we've been seeing more and more that patients may not be all that they might not trust what the doctor says. And for that, one option you have is going to the internet. The other option you have is meeting another doctor. And lack of review of medication. So we do in pediatrics something called the medicine reconciliation. So whenever a patient comes for the next visit, we ask the parents to get all the medications this child is taking, and we ask them to explain how they're giving the medication to the child. So it would be good practice for you to do the same. Whenever you visit your doctor, please carry all the medications and explain to them how you're taking each and every medication so that they can pick up something. If your dosing regimen is wrong, if the dosing schedule is wrong, they can pick it up immediately. So dissatisfaction with doctor visits, again, at times you may not be completely happy, but that shouldn't be a reason for you to not take your medication properly. If anything, change the doctor. Don't let go of the medications that you've been prescribed. And healthcare system related factors, again, can be quite a challenge in our country. So we don't have a lot of help for elderly population in our country. There is no insurance scheme for them in place by the government. So obviously, patient education, follow-up, all of these requires money. And this may lead to people dropping out of follow-up visits. And as a result, they may end up taking medications in the wrong manner. So this is so those were the 5, hurdles to adherence of medication. Now there is something called the triangle of adherence. So first of all, these are the 3 factors which one should look after if you really want to be compliant with the medication prescribed by your doctor. So the first and foremost is that you have to take responsibility of your illness. You have to take responsibility of the medications prescribed to you. If that is not possible, you will have to find someone, your caregiver, or someone else who can be with you so that your medication compliance is ensured on all days of the week. The other thing is for the doctor to educate the patient well enough to make them aware of their disease, to make them aware of the complications of their disease, and what would happen if they do not follow the medication prescribed in the right manner and in the right dosage. And the third most important thing is to ensure adequate follow-up. Now, if you're finding it hard to pay for your follow-up visits, there are multiple doctors who actually let go of the follow-up visit consultation fee. That is something one can explore. There are many good insurance schemes which will also cover for outpatient visits. That is also a good option to consider. But please do not drop out of your follow-up plan with the doctor, because that is extremely important to know if you're on the right path or not. So I think this is my last slide, and I would end by saying that medication adherence, please take your medication in the right amount, at the right time, in the right way, and for the right duration. These are very, very important. And if there is any adherence to any of these steps, please discuss with your doctor as to how you can handle it best. So with this, I'll end my presentation, and thank you so much for listening to me. And